Hello, my name is Alexandra Tarvin. I am a doctor of audiology in the United States, and I am in private practice. I have my own clinic, and I specialize in adult hearing diagnostic treatment, as well as tinnitus, hyperacusis, and misophonia diagnostics and education. In the United States, we are not able to formally practice cognitive behavioral therapy, but the reason why I took the course is because I felt like I would be more equipped with more skills, more tools to educate my patients, provide them resources, do some of those tools and resources with them, as well as incorporate mental health professionals for some of these patients, and to be able to give the mental health professionals tools and skills and greater insight into those that have tinnitus or sound sensitivity disorders. And so this course has been very helpful for me in understanding some fundamentals, as well as being able to provide additional resources, be a better audiologist and help more people. And so I am here to teach you briefly about Module 6, which is essentially the second CBT session that you would do with a patient or client. So let me go ahead and show my screen. Okay, so as you can see here, in Module 6, you will learn about the second session. So by this point, you will have already learned about all the fundamentals, as well as the first session that you do. So this would be your next visit with a patient. And the aim of the module is to teach you how to do the second session as part of this program for individuals that have tinnitus, hyperacusis, and or misophonia. The main point of the second CBT session is to design what is called a behavioral experiment, and then reviewing some previous skills that you've already talked about in other parts of your appointments with your patient. And so as you can see here, you're able to get a breakdown of the course, as well as what the objectives are for this module in the course. And at the end of the course, you also have an assessment that you can complete to ensure that you have a good understanding of the material. And so the first part of the course here, you have about 50 minutes of the actual going through the PowerPoint and the educational materials, discussing some fundamentals, some additional tools and strategies, as well as the actual behavioral experiment. And so you will go through here and be able to see this information. All of these materials that are presented and that you go through are actually also available to you. So you're able to actually look at the PowerPoint, print it off, take notes if you want to, while you were actually watching the presentation and hearing Hashir go through that. There's then the discussion. It's about 12 minutes long, a discussion with the entire group and your classmates on what they just learned. Then you have the demonstration of this. This is an hour long, so it actually goes through an entire session of session 2 that you can see role played, and how Hashir responds to the patient's responses or needs, and actually the building of the behavioral experiment. That experiment is put in the course for you actually as he completed it for this role play, so you can use that as a reference. And then you also have the discussion of the role play to kind of get any clarification or further questions. So this is what Module 6 has in store for you.